This is our smart pill bottle. You can see all the components in here. The way it works is a patient opens the bottle and immediately it sends a data signal over a cellular network to our secure software database. So it captures right when a patient opens, closes the cap. It also has a capacitor that has a capacitance level that assesses the level of pills inside. There's also a thermometer. So if a patient were to leave it in a hot car or it has to be refrigerated, an alarm, and then lights. So let's say your dose time's at 1 o'clock. An hour before, it'll start to glow. So you can see it here, slowly reminding you that your dose time's coming up. If you miss your dose time at 1 o'clock, what happens is it'll make a chime and so it'll basically be in its own alarm. It'll send you a text message and it can send your caregiver a text message that you missed your medication. The moment that you open the bottle to take out your pill, all of the notifications go away. So it's not just tracking medication adherence down to the second, but it's also a behavioral improvement tool. So we're changing behavior. And what we see is when we give this to a patient, they start to take their medication sporadically, different times a day, missed doses. And then over time, we start to see the dose being taken directly on or right before their dose time. So what we're doing is really increasing that behavior with a tool that lives in their life and has no patient burden. We have a net promoter score that's through the roof. Google claims it to be really gold standard, and that's what you want in a device. You want a device that is the most patient-centric piece of technology that you can have to support your patients. There's also 10 months of battery life. We also track the battery life down to the second. If patients have to charge it, we have the charging port. They plug it in for a little bit and we're good. What happens is we set up protocols depending on the program. So let's say a patient doesn't take their dose for a couple of days. Then we can have our team can reach out to that particular patient or the site, and then they can reach out to the patient to remind them to take their medication. And this can be absolutely crucial for adherence and medication management.